what we can do is, if we're not getting the outcome, we're not getting this sort of delta in our function that we want, we can use that opportunity when we're working together to tweak things.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
My understanding is if there is a minimal movement, it can enhance it. But if there is no movement at all, can this help or not?
It's a exceptionally challenging problem to address. And I always condition my responses on data. And so with respect to trying to make predictions about any individual person, that is going to be nearly impossible. And it wouldn't be ethical to do so. And so what I can say is, when we look at the sort of positive predictors, that is, of course, one of them. So like, there's a constellation of predictors that are really important for sort of trying to understand how someone may improve, the rate change of improvement, as well as the sort of magnitude of improvement. That is, of course, one of them, right? When it comes to the indications for these types of interventions, right? If we have some volitional activation in our extensors or in our flexors. That being said, I think there are some critical gaps in the way that those studies have been derived. And that is, under very few circumstances have we actually delivered what's called a sufficient stimuli. And so when you think about medicine, there are ways that you can dose something, right? Like, there's a dose response curve to basically everything. And in most cases of neuro-rehab, we're very low on the dose response curve. And so when we potentially draw an erroneous conclusion that we are not getting a response to individuals that don't have active movement, that could be because we just haven't dosed it appropriately. And so the reason I'm bringing this up is, in cases where we have been able to help people for longer periods of time or higher levels of intervention, we're able to actually see some return of volitional activation in cases where there is at present zero volitional movement. So I'd say those things can happen. But it's again, I'm not going to be able to say specifically if Sam's going to be that person to respond in that way.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
But I just wanted to bring that to your attention in terms of the data and what we've seen over the years. So in terms of the sort of best practices I would recommend, we should use the data that we have available to us and make those really informed decisions together. And this goes both ways, right? I'm perfectly happy with if we have tried this and we've done all of the stone turning and we have turned all of the knobs and the parameters that we can adjust, and we are still not seeing a return of function or meaningful progress, then we should have a reasonable conclusion, and it would be appropriate conclusion, that this is not a good approach for you, right? And that's totally fine. But the thing is when we don't have the ability to make perfect predictions, what I like to do is condition those decisions on the outcomes that we're observing. And so because we have the ability to collect all this data, we can monitor those various outcomes and see. And then we can continually ask the question, do we want to continue? Do we want to continue? And if we have reasonable confidence that something is working, either it's improving our activation as you described, or improving some other parameters such as reduction in pain or improving in range of motion, et cetera, then we can make, I guess you guys can make an informed decision about whether or not you value that and want to continue. So that's generally the strategy that I take in these cases, because we do have access to that information and we use that to drive the decision making.
Okay, so you have like the portion of time we use that you have a report of how they did, and you can follow up and let me know if there is a change or there is any active attempts or
Precisely.
Can record that.
Yep. And what's even better is you guys have access to this, right? It's transparency. I love this, right? Because you guys have access to that information as well. And one of the great things about us working together in this sort of fashion is that we can do these checks together. And in the actual the games and therapeutic exercises, we're collecting all this data. But then what we can do is regularly, and I like to do this every kind of 2 weeks with people, is we will jump on a call and we will ask the question. We'll say, hey, where are we right now? And we can use that as we start to generate these data points. We'll be able to generate and answer the question, are we making progress? And those early ones, I'm not so concerned about it because, neuro rehab is often protracted. But what we can do is if we're not getting the outcome, we're not getting the sort of delta in our function that we want, we can use that opportunity when we're working together to tweak things. And that's a really important element.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.